Joining me now from India is Dr. Kulkarni, a member of India COVID SOS and founder and director of AarogyaSeva. I hope I said that right. And also Dr. Kavita Patel, MSNBC medical contributor and physician and fellow at the Brookings Institution. Welcome to you both. Dr. Daya, thank you so much for joining us on this. We have been seeing reports coming out of India every single day. They are devastating. People dying in the streets, mass cremations. What is it like on the ground? What are you seeing?
First of all, thank you, Jasmine and Kavita, for having me here. You've seen the situation. It is as grim as it seems. As you step out, you're either seeing ambulances, patients who are trying desperately to seek beds, or people who are trying to deliver services as volunteers. And that number has been reducing because people are now scared to even come out, right? So it is a grim situation. Being in Bangalore, where I am, it's again it's an IT city. It's in the southern part of the country, and we just hit, as you saw, record numbers. We've crossed 400,000 mark. Bangalore itself, just the city, crosses 25,000 cases each day for the last several days.
How did it get bad so fast?
Yes, that's a very important question. I think all of us are to blame right now, but the time is not to do the blame game. We've had more than 394, about 400 deaths within 48 hours of hospitalization between April 20th and the 29th. And the reasons for this could be lack of beds, lack of triaging, lack of key drugs, oxygen, and delay of patients getting to hospitals in time. Right. And these are some of the key problems that we are facing. And there are so many ways in which right now we can look at overcoming, because right now the time is to save as many lives as we can, because we're going to keep losing. And just today I've lost so many, and this is going to continue to happen if we don't address these challenges as we go forward.
Dr. Patel, I know you wanted to ask a question. Go ahead.
I do. Dr. Daya, so one of the challenges is literally your workforce. Tell us about how many of your healthcare workers, including doctors and nurses, are getting sick from COVID, and what the impact of that is specifically for trying to take care of patients, not just in the hospital, but in homes.
Yeah, so that is another big challenge, right? So a lot of this workforces are now getting tested positive because most of them have been vaccinated. The symptoms may not be very bad, but they're still isolated and they're working at home. And the government is announcing newer beds. We're having makeshift hospitals. Just today, the city of Bangalore is going to have 4,000 new ICU beds. And that means about 500,000 new beds across the country if you multiply that. And those beds need to be managed by people. The beds are not going to treat patients on their own, and that means we need that many trained doctors and nurses to care for these patients, right? So that is definitely a big gap. And we're seeing that impact, again, lives every day.
Dr. Daya, I know that the United States is committed to sending PPE along with tests as well. What else does India need? What does India need right now to help with this crisis?
Right. So the first thing that we need is trained manpower that can treat patients in these new beds that we're going to have. Otherwise, the numbers are still going to continue. So that means we need to create quick, short training modules with expertise to train young junior doctors, residents, and nurses to take care of just COVID patients. So we need to build those protocols very quickly. And the COVID task force is working on building that. We also need teleconsultations. That is something I've been doing because a lot of these currently ICUs and oxygen beds are manned by caretakers, by residents, by nurses. So we're providing consultations and advice from specialists across the globe who are signing up. And another thing that we would help in that place is having some kind of a temporary waiver for liability, which is what is causing hesitation from international experts in coming forward. And that would definitely help a lot more volunteers, including, organizations like API, which is the American Association of Physicians of Indian Origin, and even other doctors from across England or Australia and other places who could provide consults on tele platforms, on WhatsApp, on regular phones.
Dr. Patel, I want to give you the last question. Go ahead.
Yeah, so one of the things we've learned, Dr. Daya, from looking at this unfortunate pandemic across the world is that it goes back to basic mitigation measures. We can send vaccines, we can send oxygen, but the best thing that we can do is encourage as many Indians as possible to be able to stay home. I know that that is very difficult in the country right now. How can we encourage people to fight the misinformation and to be safe at home and to wear masks and isolate safely if indeed they are positive?
People need confidence that if they're going to do that, they're going to be safe, right? And vaccination, the fourth phase of the vaccination drive started from today. That means people between the age of 18 to 45 years can get vaccinated. And that means they have to come out to get vaccinated. So there's that aspect where we want people to get vaccinated. We also at the same time want people to stay home and follow protocols and stay safe. And along with all of this, the mental health of people staying at home, but the practitioners, the healthcare providers, the volunteers is taking a toll because we're working nonstop 24/7 for the last several days, and that's still going to continue. So we need to be mindful of that and safeguard the workforces as well and stay safe in so many ways. And that means there should be confidence that can be instilled from the system, from the international community, that there is support, and we are going to kind of work on this and face this, overcome this crisis together.
Dr. Daya Kulkarni, we appreciate you so much. We thank you for all the work that you're doing out there. Please stay safe and stay in touch with us as this.
Yes, thank you. I would say, my inspirer says, in the joy of others lies our own. So I would say this pandemic is global. If it affects some of us, it affects all of us. So I'd encourage all of you to stay safe, stay healthy, and help in whatever way you can. It makes a difference. Thank you.
If it affects some of us, it affects all of us. That is for sure. Dr. Kavita Patel, thank you as always. Appreciate it.